Good morning to everyone. Your Excellency, Sire Karis, Minister Sikut, Regional Director Emeritus, Dr. Mark Danzon, colleagues, ladies and gentlemen, welcome to Tallinn. I'm Natasha Tsopardi-Muscat. I'm the Director of Country Health Policies and Systems at WHO Europe in Copenhagen. And it's my pleasure to welcome you all to this high-level meeting on health systems. But this is not just any other meeting, because we are here to celebrate together the 15th anniversary of the Tallinn Charter on Health Systems for Health and Wealth, a document signed in 2008 by all ministers of health across the region, which set out the shared values of equity and solidarity and continues to guide our work today. And today is a very special day, and it's not just by coincidence that we chose to be here today in Tallinn, not only because we told that it would be beautiful at wintertime, which it truly is, but because today is Universal Health Coverage Day. And this is why we are here to mark the day also. And later today, we shall actually be issuing our report on financial protection with data from 40 countries across the region, with a stark wake-up call to ensure that we continue to persist with our focus on universal health coverage. I look around in the audience, and I know that some of you were already here in 2008. Others perhaps in 2013. Minister Riina and myself were here in 2018, and we're here again. And throughout, we have had the fortune to be graciously hosted by the government of Estonia. And again, I would like to start by thanking you all, and particularly allow me to thank my counterpart in the Ministry of Health, Dr. Heli Laamen, who has been my partner in this journey. Of course, this would have not been possible without the support from our colleagues in the European Observatory on Health Systems and Policies, and many of you were with us yesterday night as we came together to celebrate the Jubilee. And before turning to our distinguished speakers, I would like now to introduce my colleague and co-moderator, Dr. Kristiina Koller, who is the WHO Liaison Officer for Estonia. Kristiina.
Thank you very much, Natasha. Please let me welcome all of you to the opening session of this Tallinn Charter Anniversary Conference on strengthening our health systems for the future. Trust and transformation will be the guiding themes of this conference, and we therefore have structured the meeting in two parts. Today we will look at trust, what it is, why it is important in health sphere, and what are the issues when it is in short supply. Tomorrow, we will focus on transformation. What are the challenges we need to implement in our services and our systems to make them more resilient and sustainable for the future? But as these themes are intrinsically linked, we cannot transform without building or ensuring trust, and we cannot build trust without transforming our systems. Especially in the aftermath of COVID-19, we will talk about both on both days. Often, conferences on health systems are structured around the traditional building blocks, such as the workforce, financing, pharmaceuticals, or information. But this conference will be different. People will be at the heart of this conference. Its starting point is that healthcare in the 21st century is best designed and delivered in the spirit of trust and co-creation between people, patients, health professionals, and policymakers. But before we delve into these ideas, may I invite Her Excellency, Madam Sirje Karis, First Lady of Estonia, on the stage for the opening speech.
Good morning, everybody. Good morning in Estonia. Distinguished guests, ladies and gentlemen, trust is a glue of healthy society. A healthy society does not just mean healthy people. It also means healthy democracy. Recent crises have challenged both and made us understand how important is trust in supporting resilience and essential transformations. It is a great pleasure I welcome you to the anniversary gathering of Tallinn Charter, where our focus today is trust, transformation. This is needed follow-up to the principle of solidarity, equity, and participation that the Charter laid out 15 years ago. These principles have proven to be the keystones of resilient and sustainable health systems. But not just health systems. I believe the transformations in health systems can serve as a model of building resilient and sustainable societies at large. This shift is vital since contemporary challenges, such as climate change, impact all aspects of the society. This means that it is time to integrate the health dimensions into all policies, from education and environment to food and transportation. And we also need to recognize that the role of health systems extends beyond securing the physical and mental health of the population. We know that the healthy population is also smarter, richer, and better able to ensure its security. But there is no better place than today's conference to emphasize that health systems can serve a crucial role in creating and maintaining public trust. The COVID-19 pandemic tested our health systems and the crisis resilience of the entire planet. In terms of trust, there were encouraging signs. The public opinion surveys showed that the people trusted doctors, opinion, medical experts, and scientists the most. The level of trust towards them was exceptionally high and was often reflected in the wide support for relevant policies. On the other hand, this trust did not always translate into desired behaviors, particularly vaccination. Despite the trusted experts telling people that the best way to protect themselves is to vaccinate, we observed remarkable differences between countries in vaccination rates. This illustrates the complexity of trust dynamics. For example, studies have concluded that the level of trust for public institutions was a more important factor than trust towards the medical experts. We all need to weave the carpet of trust together. Otherwise, our efforts to build trust on one front may falter if trust is eroded elsewhere. Therefore, We need for transparent and inclusive governance in policy making. We also need competent and accessible health systems. And naturally, we also need genuine human interactions. People expect to be listened and empowered. They wish empathy and respect. If all these aspects come together, we can create an atmosphere of trust in society. The atmosphere in which not only health system, but any societal system can operate to their full potential and transform in response to the modern challenges. In Estonia, we have two excellent examples that can demonstrate this. First, in our public digital system that includes widely adopted health e-services. The second is the Estonian Biobank, which has gathered genetic samples from more than 200,000 Estonians, including my husband. These hugely ambitious projects would not have succeeded without a foundational commitment to gaining the trust on all levels of the society. The importance of trust is well understood by those who wish to undermine democracy. This is why using this information to attack our sense of security and trust is a common tool on their arsenal. We witnessed this frequently during the pandemic, but let us be aware that the field of health is just a convenient playground for these people. Their main aim in spreading disinformation is to polarize societies, create trouble, and breed distrust in experts. The result is not just harmful health behaviors, but also a threat to national and international cooperation. The wide-reaching effects that such information warfare can lead to, for example, limiting the ability of World Health Organization to respond to the global health crisis, or restricting our support to Ukraine. We know that higher levels of public trust make people more immune to false information. Given this, we must recognize that health systems cannot combat disinformation alone. It necessitates a collective effort to boost public trust. Dear guests, the Tallinn Charter of 2008 emphasized that health is an investment rather than a cost. In a similar manner, let us acknowledge that building trust is an investment. This investment provides us with the capital needed to propel essential transformations in our health systems, making them resilient, sustainable, and fit for the future. I wish you a very successful conference, dear friends. Thank you.
Thank you so much, Your Excellency, Madam Karis, for sharing those really wise words which will continue to stay with us over the course of the next 48 hours. And now it is my sincere pleasure to welcome to the stage Dr. Mark Danzon, the Regional Director Emeritus, who will read out the statement prepared by our Regional Director, Dr. Hans Kluge, who very sadly was not able to be with us here today. Thank you, Mark, for joining us.
Good morning. Don't worry, we are not back in 2008, and I am no more the regional director. The real one is Dr. Kluge, you all know, but he is not well, and he asked me to replace him this morning. I'm sorry. I would have preferred to be in the room with you and listen to him. I like listening to him. He called me this morning and asked me to reassure you he is not well, but he said recovery, I quote, will come soon, and he will be in perfect shape to start the new year 2024. I am sure you join me to wish him prompt and total recovery. And now I will read the presentation he prepared for us. I read it. Ms. Garris, Minister Sikut, honorable ministers, colleagues, and friends, what a great pleasure to open this meeting with you today. That's exactly the word he wanted to tell you. It is a common perception that the world today is less safe, more unequal, partisan, and driven by unaccountable business interests than in the past. Growing dissatisfaction with the traditional political systems, with institutions, and magnified by disinformation is a threat to the very fabric of our societies. This is why we have designed this conference in a new way, engaging the health and care workforce, policymakers, and patients in producing the evidence base, as well as participating here today. Patients such as Mira. Mira is an important person today. Mira Jutankeva, a 67-year-old woman living with diabetes from Kyrgyzstan, interviewed for one of the case studies we have developed. Mira said, "The most important thing is visit the doctor, take care of your health. I tell this to everyone." Close the quotation. It's a sentiment that I think sums up what many people, particularly older generation, feel when they think about the health and health system. But this simple statement assumes several things. Yes. You have access to a doctor. You can get the medicine and treatment you need. You trust the health system. You partner with it to make informed decisions about your health, and you live in a place that nurtures health. As you know, the reality today is that our health system and our societies cannot guarantee this condition. And with the long shadow cast by COVID-19, the climate crisis and conflicts, the context under which health system operates is ever more complex. Generating more resources for health, delivering more services, and doing so more efficiently in the conundrum that keeps many of us awake at night. It's Hans Kruger who speaks, when I introduced the European Programme of Work in 2020, its starting point was to respond to citizens' legitimate expectation toward health authorities. The central premise of us coming together in Tallinn take this further, seeking to strengthen trust, to transform our system, building on the values of solidarity, equity, and participation, enshrined in the Tallinn Charter that all member states agreed to 15 years ago. So in the next few minutes, let me look across the WHO European region to see where we stand now regarding what Mira called the most important things. And what we need to do better, it's in a way a system checkup and prescription. Firstly, the first question. Do people have access to a doctor? The answer is it depends where you live and your status. By 2030, critical workforce shortage are expected to lead to a global gap of 10 million health and care workers, a gap of 10 million. Although the European region has the highest level of healthcare workers in the world, the coverage is uneven and we lack healthcare professionals in rural and underserved areas. With many thanks to the member states for their endorsement, we now have a framework for action on the health and care workforce. It outlines what we must do urgently to not only increase the number of nurses, doctors, and health professionals, but also to protect them and ensure they have the skills to meet future needs. Second question, are people able to get medicine and treatment they need? Today we are launching a new report produced by the WHO Barcelona Office for Health System Financing that gathers evidence on financial protection for 40 countries across the European region. The simple answer is no. Far too many people today cannot afford to pay for health care. A median of 6% of households experience catastrophic health spending, mostly paying for medicines. So they cannot longer afford other necessities, such as food or housing. This rises from 6% to 20% among the poorest fifth of the population. And financial protection has worsened over time and over 2/3 of the country analyzed. Dear friend, this is not the message I want to be sharing today. Today is the Universal Health Coverage Day, but progress is possible. And the report provides a checklist of good practice, such as making sure primary health care covers treatment as well as consultation and diagnosis. On this, let me congratulate Estonia for your effort to produce co-payment for outpatient medicine and introducing a digital solution to remove administrative barriers. Third question. Do people trust the health system and health professionals? As part of the evidence base for this conference, the European Observatory on Health System and Policy has produced a series of 5 policy briefs. One of them looks at trust. Trust matters. Trust is a complex concept to navigate, and we don't have a full picture of trust and health systems. But a survey by Wellcome Global Monitor in 2020, for example, revealed that the percentage of people who answered a lot to the question, how much do you trust doctors and nurses in the country, ranged from 14 to 77% in the 40 countries of the study. To bolster trust among patients, taking action and pervasive practice that undermine trust, such as informal payment for healthcare, is crucial. We need to value trust and nurture it. Fourth question. Do health systems work in partnership with patients? Transforming our health system is necessary, not only to improve health services delivery while containing costs, but also to realize the full potential of people to be co-creators. That is a very important subject. People being co-creator of the health system. Primary health care is the nearest we have to a panacea, emphasizing prevention, reducing the need for more expensive and intensive treatments, centering health care provision firmly in the community, responding directly to misinformation and allowing people to build relationships with multidisciplinary health teams. It is also primary health care where incorporating digital health solutions can be felt more directly, tackling LCD, risk factors, offering long-distance service, delivering responsive mental health care, and just around the corner, implementing artificial intelligence-enhanced personalized care. The opportunity of artificial intelligence brings us back to the issue that transforming our health system is dependent on trust. People, patients, and health professionals must be absolutely certain that their data is safe and secure and that the system is working in their best interest. Which leads me to the fifth and final question on our health system checkup. What are we doing to ensure that other sectors and society are nurturing health? Since the Pan-European Commission on Health and Sustainable Development shared its conclusion over 2 years ago, we have intensified our effort to promote the well-being economy. I, Dr. Kluge, have been advocating to use the health and care sector, which account for 10% of total employment in the region, as a lever for equitable, participatory, and green development. A key stand in the Budapest Declaration on Environment and Health is for the health sector to set an environmental example and cut carbon emission, reduce pollution, and strengthen climate resilience. Bringing the health financing and economy sector together around investing in healthy, prosperous, resilient society for all is a recipe for better health, stronger social cohesion, inclusive economic growth, greater stability and peace. So where do we stand now? Dear colleague, we stand at a crossroads. In 2024, 4 billion people across the globe will be going to the polls. The European region will see 9 parliamentary elections and 5 possible presidential elections next year. We must demonstrate that health systems are working for both the people who use the services and the professionals who deliver them. In the past, we could rely on Mira's viewpoint as a norm. This is no longer a given. I am committed to ensuring broad participation as we look ahead. One of the sessions on the agenda tomorrow, for example, is how to engage civil society and use to promote trust and health system transformation. Let us use the next 2 days to fully explore, understand, and map up how we can move the implementation of the Tallinn Charter forward over the next 5 years, laying the foundation for a new vision for the health system that will serve our children and grandchildren. I would like to express my deepest thanks to you, Ms. Karis, and you, Minister Sikkut, as well as to Estonia for your long-lasting commitment to strengthening health system across the region. As they say in Estonian, that is a difficult part for me. Tasa suad kogele juad, which means steady row, far you will go. Thank you very much.
Thank you so much, Dr. Danzon, for making the speech and being here with us. Indeed, Mira's story speaks very well to the vision for health system strengthening across the region, and the links to the Tallinn Charter remain valid and strong, and particularly the message about leaving no one behind. It is my pleasure now to introduce Riina Sikkut, Minister of Health of Estonia, for the opening speech.
Honorable First Lady Sirje Karis, Regional Director Emeritus Dr. Danzon, ministers, colleagues, ladies and gentlemen. It is a privilege to celebrate the 15th anniversary of the Tallinn Charter with you here in this winter wonderland and on the Universal Health Coverage Day. It is very symbolic. In a person's life, 15 years is quite a turbulent age. Not sure yet who you are, searching for a place in the world, maybe engaging in risky behaviors, but luckily we cannot say that for the Tallinn Charter. Tallinn Charter has come to a maturity, but it's still very much alive and full of energy. And as it is customary on birthdays, I would like to take a look back. So during the next 2 days, we'll discuss how to move forward. But let's first look back. What has changed in 15 years? And have we been successful when looking at the commitments we made back in 2008? So first, Tallinn Charter put health and health systems in a new perspective, looking at health as an investment. I would say that we are not there yet. We have a few champions, Finland and Iceland, who have really made sure that the concept of well-being economy is carried forward in their societies. But the rest of us, we are still in the early phase with the need to put the well-being of the people in the driving seat next to the economic growth. So it is very important to underline the call in the conference outcome document to seeing that health and well-being of people is a key driver of well-being economy by recognizing the interdependencies between health and the economy. Secondly, the Tallinn Charter also was novel at the time of its adoption, taking a broader and more systematic view on the core functions of health systems. So next to the more traditional functions of providing healthcare, it also encompassed influencing policies and actions of other sectors to address social, environmental, economic determinants of health. So where are we? Healthier and more balanced nutrition, it is not only an individual choice. I think we all can agree. It depends on the available offer in our shops, schools, and workplaces. Secondly, a more successful story. The prevalence of smoking has steadily decreased because it is not a norm in our societies anymore, largely thanks to the tobacco control legislation and policies. But yet, the industry is in search for new markets and customers, attracting young people with new nicotine products. So the challenges continue for us. And lastly, alcohol use. Very relevant in the Estonian context, it remains a public health concern with wider societal implications that cannot be overlooked. In September, at the UN General Assembly, there was a side event where I had a very good panel with Ingvild Kjerkol, the Norwegian Minister of Health. And although the Estonian alcohol consumption per capita has reached 11 liters and is increasing, and Norway has gotten their consumption level down to 6 liters per capita. The discussions in societies, the pressures, commercial pressures, are very similar. So wherever we are now, we need to be persistent, not to allow commercial interest override public health interest. And the challenges are common, and we are stronger to face them together. Thirdly, from 15 years ago, the main values of the Tallinn Charter were solidarity, equity, and participation. And I think we all can say that they are essential, relevant, and when we discuss how to move forward, solidarity, equity, and participation, they are needed to create trust, to keep trust in the system, and also to transform health system. The unique feature of most healthcare systems in Europe is that access to care does not depend on how much money you earn, making Europe a world leader in equitable access to care. But we still face problems, as was described by a very good impersonation of Hans Kluge by Dr. Danson, that when we take stock and look at the situation in 40 countries, we realize that the access is not universal. We still have important steps to take. And keeping to the value of solidarity is not always easy, especially in the context of fiscal and resource constraint. We need to always be able to argue why the investment into health is important. And in many countries, for example in Estonia, the investment into health is seen as an ideological question, without realizing that actually it is an evidence-based solution. That the solidarity-based healthcare is not something, it's not a political choice, it's something that actually delivers us better. Estonia spends only around 7% of GDP on health, which is much less than EU average, but we think we are very proud that we use the money efficiently. And we deliver very good results using e-solution for the 7%. But my personal challenge is to increase it, because 7% is not enough when we look at the future. At the same time, we still need to make efforts to attain universal health coverage and to reduce health inequalities. We are facing difficult decisions in the coming years to ensure the financial sustainability and maintain the current level of services and financial protection. This will require a critical review of public funding sources and extending the revenue base beyond employment-related tax income in the case of Estonia. I can't agree more that we need a strategic approach based on evidence-informed narratives and the health system performance assessment framework will be a useful tool for health ministers to be able to demonstrate the performance and the gaps in a systematic and evidence-based manner. And last, this brings me to the main theme of today's conference: trust and transformation. The world has changed in 15 years, and we have faced many crises, we have new challenges. The level of the campaign of disinformation is something we couldn't imagine 15 years ago. But while tackling the current and future crises, we need to realize that a well-resourced health system and a well-functioning health system is better prepared to face any crisis. And the same applies for the society. So a well-functioning, a trusting society is well prepared for any crisis, whatever we need to face. So today's and tomorrow's discussions on trust and transformation, they're not for a specific use, or not for just health system or a crisis situation, but for anything we have to face in the future. When talking about innovation, people often think about digital and technological innovations. And this is no doubt important if we want to transform our health system. But sometimes innovation can be how to create trust in a clever way, how to talk to people or patients in a way that they actually change their behavior. Estonia has been quite successful in adopting e-health solutions and services such as electronic health record, digital images, e-prescription, e-consultations. So now from our experience, the digital tools can save us resources and make the system more efficient. We have realized that although we implemented the changes for efficiency reasons, now using the data and improve services and better designing benefit schemes, we can achieve the goals of equity and better outcomes. It wasn't our goal in the first place, but this is something, a positive externality that has occurred. Digital technologies are becoming a game changer also in the way that people interact with the system. So when we think about trust, the First Lady mentioned empathy, looking into a person's eye, having real discussions. So how do we keep that or ensure this in a world of technology and these solutions? So digital technologies can empower us. We have all these smart devices, and people can actively participate in their own healthcare journey. But we are still people, we have health issues, and we want personal advice and personal approach. So the role of health professionals is also changing. They need to be supported by adequate training, and it is important that the new solutions are integrated within the workflows and benefit the everyday work of professionals. And the future, I believe, is personalized. This precision medicine. And as with Mr. President, I also donated my blood sample to the Estonian Biobank. And so 1/5 of the adult population is covered. We have the information. Now we need to ensure the population that we can use the data safely and incorporate this into health service provision to benefit everyone's health. Also, organizational and cultural change are issues that sometimes act as barrier, and they might be the most difficult ones to overcome. It is difficult to break the conventional roles and the service models, but in order to transform these models, we need trust. We need to trust that we have the same goals, and we need to trust that everyone will do their share in reaching towards goal, and everyone will do their part considering the benefits of others and achieving really the best outcomes that current technology and science allows. So finally, I am very excited about the conference program. And I look forward to the discussions, the interactive discussions, the parallel sessions, the ground we cover during these 2 days. It's very broad. I hope we can, after almost 48 hours, to look back and say that, yes, we have made maybe small steps, but certainly steps towards achieving the goals and keeping to the values that we committed to 15 years ago when we signed the Tallinn Charter. So let's use this opportunity of coming together to exchange ideas, learn from each other, and finally get inspired and change something in the coming years. Thank you.
Thank you very much, Minister Sikkut. I'm sure you will agree that this was really an exceptional keynote, combining, of course, your technical and political background so perfectly well. I won't attempt to try to summarize, but I will say you reminded us of the keyword participation and your call to everyone to play their part. And I think this takes us very nicely to the concept that we have tried to build in to this conference, and in fact we are starting this opening with 2 persons who have kindly agreed to join us. Stacey Brooke, representing the patient community, and Rachel Clark, representing the health and care workforce. And we've asked them to tell us why for them trust is important and what kind of changes we need to carry out so that patients and professionals can really get involved with transforming their health systems. So I would like now to invite Stacey Brooke to come to the stage. Stacey and I met last May in Geneva. Stacey is a young stroke survivor and advocates for what she calls passion-based therapy. It's truly a pleasure, Stacey, to be able to have you with us today. Thank you for coming.
It's my great honor to be here in Tallinn. This morning, I would like to begin with a question. So if you will humor me, I want you all to close your eyes. Take a deep breath. And think about, what are you most passionate about? What makes you forget to eat? What, when you do this thing, makes you come alive? What makes you feel as free as a bird? Think about it. And when you have an answer, open your eyes and remember this emotion, this passion, this feeling. We'll circle back to this in just a moment. I'm Stacey Brooke. I'm a writer, a digital course creator, a mama to 3, a wife. And 4 years ago, I added stroke survivor to that list of roles and achievements. At 46 years old, I suffered a 1 in a million stroke from a carotid artery dissection. When I woke up from a 10-hour surgery, I couldn't walk, talk, or feed myself. It left me close to death. Yet, within 4 years, I'm standing in front of you today. Was I lucky? Absolutely. But I think my story is about more than just luck. It's about my absolute refusal to go, take part, or to see anything that didn't seem right to me at that time. Now, I will admit, I'll be the first to admit, that in those days or weeks or months after my stroke, my head was utterly foggy. And by the way, it still is sometimes. However, instinctively, I knew that there was something more than what my neurosurgeons or my therapist or even my well-meaning family and friends could think of or could imagine for me. So instead of being placed in a rehab factory, I bulldozed the white coats and anyone, for that matter, who didn't see my recovery my way. Unwittingly, I went full force towards a more holistic approach. Despite not being able to speak, read, or write, I began relentlessly following my passion for writing. From my hospital bedside, I worked with Seth, my speech therapist, my partner in crime, 7 days a week, 2 hours a day. And when I was well enough to come home, I worked with him the same amount of time from my desk at home. In fact, I just came from my speech therapy session with Seth hours ago. We created therapy around my passion for writing. And guess what? It transformed my agraphia, my aphasia, my cognitive deficits. It shaped my recovery journey. I believe that recovery begins with a survivor taking their passions to the healthcare professionals. And together we work towards a shared vision. After your life is saved, focusing on your mental, emotional, and social well-being is paramount. And when the healthcare professionals see us as people with dreams, passions, instead of patients, there is a much greater impact. If we see ourselves as part of a team instead of patients and doctors, we perform better because we're working off the same energy. Imagine that you wake up tomorrow in a hospital. Your right side is paralyzed. You cannot speak. You need help to go to the toilet. And imagine your neurosurgeon telling your spouse that you will never read or write again due to your severe aphasia. Imagine being prescribed antidepressants because of the significant amount of weight that you've just lost, not at all because you're depressed. Imagine a close friend proclaiming, "I'm sick of your stroke." Imagine yelling at your children, at your laundry machine, and not being able to count, not being able to set the dinner table properly, breaking a glass, crushing it with your bare, stroke-affected hand, feeling like a social pariah, being afraid each time you close your eyes. Imagine the sadness of lost relationships. Imagine being told by your doctor, you can walk, you can talk, why don't you just be happy with that? And then imagine getting up each day defiantly, because that's exactly what stroke recovery actually is. Now, let's circle back to your passions that you just visualized a few moments ago. This passion transcends any illness. Latch onto it, make room for it. And if you're lucky enough, you will have the grit to build a village around you, the guts to make a plan for yourself, and the moxie to keep following this passion no matter what life challenges you with. Personally, I have found the approach of passion-based therapy more motivating than sticking pegs correctly in the right holes or fishing out objects from a box of beans. I still have trouble finding my keys if I've stupidly placed them in my right-hand pocket. Success breeds success. I feel empowered each time I write one word, a whole sentence, or a speech. Now, I realize that implementing passion-based therapy in the healthcare system is challenging. Resources are limited. There's a lack of standardization. And to measure its impact is tricky. However, it enriches our experiences as survivors. And I wholeheartedly believe that passion-based therapy is a strong building block to meet us where we are right now. I see a world where we continue to build on this people-centered care with the significant shifts towards holistic and equitable care with a focus on mental health. One where embracing your passions and following them in an all-consuming manner with your doctor and your therapist just by your side, that can lead you to your next version of yourself, to your 2.0. 4 years ago, I woke up in a hospital bed, unable to speak, move, or even to recognize my own children. I was trapped in a silent world, a stroke survivor's straitjacket. Today, I stand before you as living proof that trust, belief, and passion can transform the seemingly impossible into reality. But my journey is just one example. There are countless others who can achieve great things with passion and trust in themselves and those who believe in them. Recovery from stroke, battling an illness, or simply trying to live a wholehearted life extends beyond the physical. Employing passion-based therapy as a basis for your transformation, now this is a game changer. To foster trust and transformation in the healthcare system, let's begin with recognizing patients as people with sparkling dreams, goals, and potentials. Thank you.
Dear Stacey, thank you so much for sharing your story with us. Not just the story of your courage and strength, but the story with a very clear message to all of us. And that is that we need to be better listeners. Person-centered care means doing what's best for the people. And that has to be defined not only by decision makers alone, but rather through the dialogue with the end users of those services, patients and their families. But so too must we listen to those who provide those services that we are looking to improve. And to help us better understand this perspective, may I now introduce you Dr. Rachel Clark. Dr. Clark is a former broadcast journalist, current NHA palliative care doctor and author. And after a visit to Ukraine this year, she established a registered charity called Hospice Ukraine to support the development of palliative care in Ukraine. Rachel, please, may I invite you to the stage.
Thank you very much indeed. And like Stacey, I feel really honoured to be here today. Stacey, that was an incredible talk to hear as a doctor. Thank you for that too. Let me start, as Stacey did, by posing a really fundamental question, going right back to basics. What is the reason why all of us here today are in this room? And I think the answer is probably very simple, isn't it? We are here because fundamentally we want to help people. That is why everybody gets involved in the business of healthcare. We care enough about vulnerable people, and all patients are vulnerable. It doesn't matter how much power or status or wealth you have in society. If you're a patient, you're vulnerable. We're here because we care enough about that vulnerability to try and do something about it. That's what we're doing here in this room today and in our professional lives. And I'd like to ask you to just keep that fundamental context in the back of your minds while I now begin by briefly telling you a story from my clinical practice, which I believe encapsulates why, for healthcare professionals, trust is the absolute bedrock of what we all do clinically every day at work. So I am a specialist in palliative medicine. I work in a really busy, big urban NHS hospital in the UK, and Conditions these days are pretty tough in a lot of our hospitals. We are very overcrowded, very understaffed. There are so many patients compared to the numbers of us, the frontline clinicians trying to care for them. And that can make any form of practice difficult, but perhaps palliative medicine particularly. These days, it's often the case that my hospital is completely full. There isn't a single free bed in the hospital. And that state is euphemistically known as Opel 4 in NHS speak, which used to be known less euphemistically as Black Alert. Black Alert used to happen in winter. It now happens in spring, summer, autumn, year round, pretty much. We spent most of July and August this year on Black Alert. And when that happens, you can't get a single new patient into the hospital because there isn't a bed for them to go into. So all the ambulances bringing the sick patients into hospital get stacked up outside. We can't get the patients out. All of the corridors in A&E are filled with patients. I may have an end-of-life conversation with a patient, literally on a trolley, in a corridor, without even a curtain around them. It's tough. But the story I'm going to tell you is, I hope, a little bit more uplifting than that. And it's about a patient whom I'll call Joe, who came into the hospital recently with a diagnosis of motor neurone disease. And he was quite young, in his 50s. He came with lots of family members. And his disease had rapidly deteriorated at home so that he was unable to breathe unaided and completely unable to speak. He was supported by non-invasive ventilation, so the kind of mask that we often used on COVID wards with patients, a really tight mask that forces air into a patient's lungs because their muscles are too weak to bring air in themselves. Quite unpleasant. People say it feels like sticking your head out of a car on the motorway and you feel air being forced into your lungs that way. So I met Joe and could see immediately just how sick he was. I knew that he was potentially sick enough to die in even a matter of hours. And I had to decide how to proceed with that knowledge. He couldn't speak. The only way we could communicate, and he could communicate his wishes with me, was by squeezing my hands to say yes. So what do you do in that situation with a patient and their children, their brother, sister, and parents all there sitting around you? You're not in a private room, you're on a busy, overcrowded ward, there's no privacy at all. How do you proceed? Are you completely honest with your patient, or are you not? If you're not honest with them, how can they possibly trust you? But if you are honest, are you going to look that man in the eye and say, I think you are sick enough to die now, any minute? You could die right now and it wouldn't surprise me. Are you really going to be that honest with the patient? And these are the kinds of clinical situations we face every day in frontline medicine. So I did what any good doctor would do, and I tried to build a rapport despite those conditions. I focused intently on my patient. I looked them in the eye. I forgot about everything else. And I started with some simple questions. It looks like you're really struggling to breathe. Please, can you squeeze my hand if it's hard for you to breathe? Yes, he squeezed. Would you like me to give you some medicine that will help you feel less breathless? Squeeze to say yes. And then a really important question. Are you feeling frightened at the moment? Yes, he squeezed my hand. I knew he was frightened. He looked absolutely terrified. And then I asked a more pertinent question. Are you feeling frightened because you're so worried about your breathing? You're worried that you might suffocate? Yes, he squeezed my hand. And then I asked, the really risky question for a patient, the one that feels like it may cause harm, but if you don't ask it, you're not doing your job as a doctor. I said, are you frightened because you're afraid that you may be sick enough to die? And he squeezed my hand. And then I could ask a crucial question, which was, it's really common to feel like that. When you can't breathe properly, it's a horrible, terrifying sensation. Everybody's frightened. But there are things I can do to help you with that. Would you like me to give you some medicine that will help you feel less frightened? He squeezed my hand. It may make you feel a little bit sleepy, but it'll definitely help you feel more relaxed. Squeeze to say yes. And at that stage, I was able to make a slight joke, an attempt to communicate to this man that he wasn't just a patient, as Stacey has just described so beautifully. He was a human being. So I said, okay, I can definitely give you something to help. It's a really nice drug. Some people say it's a bit like being given a very, very strong double gin and tonic. At which point, his family didn't smile. They all looked horrified. I thought, oh no, I've overstepped the mark. And they said, he does not like gin. He likes whiskey. It would be a double whiskey. So I was like, okay, Joe, I'm terribly sorry. Let's say it would be like a double whiskey. Smiles all round, because although Joe couldn't speak, and although he was terrified he may be dying, and he was right to fear that, he could still smile. So a little bit of humanity had been injected into that consultation. So I sorted out some medicines, and we agreed that I would go back a few hours later to see how he was doing. In the meantime, I asked the nurses if they could possibly use superhuman efforts to find a private room so that this poor family could have some privacy. When I returned, it was pretty much when I was meant to be going home, but that was fine because Joe needed help. I went to see him. He was much more settled, but he was also much, much iller. And although this mask was forcing air into his lungs, all of his numbers, his observations, his clinical state all suggested he was losing the fight and he was beginning to die. I had to have another incredibly difficult conversation with his family about how we would proceed. And we all agreed collectively that the right thing to do was to try and wean Joe off this horrible mask, wean down his oxygen, and help him be as comfortable as possible so that he might slip away and not be aware of any fear or suffering at the end of his life. And at that stage, his son, his whole family were distraught, said, God, Rachel, I wish I could have some of that drug that's like the double whiskey, I really do. So I said, well, it just so happens that I might be able to help you. I can't give you any of that. I don't have any whiskey in the hospital, but I do happen to have a bottle of wine. Would you like me to bring it? Because I'm sure I can find some plastic cups, and you can all sit and toast Joe if you would like that. And the family immediately said, yes, please bring us that. So I had a bottle of wine because my birthday had been the day before and my team had given me a bottle of wine that I hadn't brought home yet from the hospital. So I went off to our palliative care office to write my notes, shoved the wine in the little freezer we have in our office that's filled with ice lollies, which can be really wonderful to suck at the end of life. Shoved the wine in there, gave it a deep chill for 20 minutes while I wrote my notes, and then went back with my nice bottle of chilled Sauvignon Blanc, some plastic cups, and I left a family sitting, drinking chilled wine with someone they loved more than anything as he died, and indeed an hour or two later, Joe's life came to an end. I tell you that story emphatically not because I did anything special, but because for me, it was a staggering privilege to be welcomed into what was undeniably, for that patient and that family, one of the most traumatic and wretched and desperate days of their life. I was welcomed in as a doctor. They trusted me enough to be able to help them through that awful traumatic time, and using nothing more fancy or high tech than my words, my attention, and a bottle of wine as a symbol of the fact that this human being, this patient mattered. To communicate care, we were able to help this patient. That is what healthcare workers want the world over. We want to inhabit a working environment that we can trust to allow us to do our job of helping people. I refer you back to the question I opened this talk with, why we're here. We want to help people. Every doctor, every nurse, every allied health professional, we're in the jobs we do because we simply want to be able to help people. And what we want more than anything is not recognition or being patted on the back or being told that we're a hero because we risked our lives in a pandemic. We don't want that. We want to be able to do a decent job of helping our patients, and we want to be able to look them in the eye and know that when we say to them, I am going to help you, I am going to do a good job of looking after you, that is true because we inhabit conditions of work that enable us to do that. But do we? And that, of course, is the million-dollar question these days in every healthcare system. It's particularly acute and challenging a question after COVID. We know that the conditions of COVID were unimaginably traumatic for staff, that the sheer numbers of death and dying that we saw on COVID wards, I will never forget in my professional life, and I say that as a palliative care doctor. It is also the case that the inhumanity of the conditions of COVID wards, the barriers put up by PPE, were deeply traumatic for us as frontline workers. I will never forget realizing in week 1 of the pandemic, when I started to see my first patients with COVID, that every single patient who was coming into the hospital with COVID and dying of COVID was destined never ever to see another human being unmasked again. They would only ever see masks. They would never see human faces again. And to try and operate with compassion and humanity as a doctor in those conditions is incredibly hard. I want, though, to finish by proposing 3 lessons around trust from the perspective of a healthcare worker to take forwards in our discussions over the next 2 days. First lesson: never ever underestimate in healthcare the sheer power, the potency of tiny things, words and tiny acts of kindness. They communicate entire worlds of what's important in healthcare. They are our way of communicating humanity and saying to a patient the vitally important message, you matter, we care about you, and we are here for you. They are our superpower. 2, if you are a political or systems leader responsible for healthcare, then please be mindful of the fact that the words you use are every bit as powerful as the ones we do. And ideally, you would have a relationship with us, healthcare workers, and the public writ large, that is exactly the same as the relationship that doctors have with patients when we use our words. You have to use words with candor. You have to be honest. You have to tell the truth about what isn't working in healthcare. The NHS is overwhelmed at the moment, for example. It was overwhelmed during COVID. If we can't be honest about that, you will never inspire the trust of your workforce. So be honest, be candid. And finally, remember this fundamental point. What healthcare workers want more than anything is unbelievably simple. It is circumstances of work, daily working conditions that we can trust will enable us to do our simple but absolutely life-affirming job of caring for patients who are vulnerable. That is what we want. And my final thought, an important thought I want to leave with you all is, please, please remember to think about the importance of carving out a space in healthcare for the act of caring, by which I mean not productivity, not something that can be measured or quantified on a spreadsheet or counted on an abacus. The bottle of chilled Sauvignon Blanc does not exist in the NHS. It will never, ever be recorded anywhere that counts on a spreadsheet. But it is absolutely imprinted on the minds and memories and hearts, I believe, of one family who was helped in one desperate set of circumstances in the NHS. If you can carve out space and time for your healthcare professionals to provide that degree of humanity with one patient a day, then you are giving them the inspiration that they need to go the extra mile, to keep working in overstretched healthcare services, to not burn out, to not quit because it's too tough. That's our superpower in healthcare, and let's try and harness it. Let's never forget it. Thank you very much.
So when I told the team I want an honest, different opening that will make us feel something, I didn't realize that I was going to get more than I had bargained for. Just listening to Stacey and Rachel, I think their testimonies meant something to all of us. But I think what is clear is that we do have a problem with our health systems that needs to be fixed, really, at its heart. And in fact, when we started preparing almost a year ago for this conference, we asked ourselves three things. I think Rachel mentioned black alert, spring, summer, autumn, winter. This is what we hear from so many ministers and policymakers everywhere. So we asked ourselves, why in the aftermath of a pandemic, when more people than ever have turned to our health services, do our health services continue to garner poor headlines? Why, after all the sacrifices made by health and care workers, are people leaving the profession feeling undervalued and underappreciated? Why, after so much spending and innovation during the pandemic, has the important lesson, as Rina told us, of health as an investment rather than a cost, not really been properly understood? And of course, I think one of the things that we also heard from the First Lady this morning was around trust and science skepticism. And because as health professionals we bring the science, we are at the heart of this very difficult issue that is being played out in societies. And of course, as we have just heard, the patients lose trust, the health workers lose trust, and the decision makers, I know ministers of health, are in difficult situations because the ministers of finance sometimes lose trust too and say, how much more do you need us to give you to see tangible change and results? And they're not happening. And thinking about this, I'll ask you also to picture and visualize something. And I'm going to ask you to picture a wall, a brick wall. Our health systems are walls that protect us. They protect us as individuals. They protect us as societies from disease, from environmental crisis, accidents. But what is happening is that this wall is being faced, if you wish, by one wave after another that keeps crashing. We spoke about the waves during the pandemic, but the waves just keep coming. And of course, being from a small island where wind and water are a constant, I know that bricks can be eroded. But what do we do? What are we doing? We try to see the brick that is most in need of fixing, we replace it. Maybe we try to build higher, wider, because as Rachel just said, we all want to do better for our populations. Whether we are ministers, whether we are health workers, we all want to do better. But how are we doing it? Sometimes we are doing it just by focusing on medicines, by focusing on the new thing, digital, by focusing maybe on training nurses. We're putting more and more bricks. But perhaps what we need to do to ensure that they don't all come crumbling down with the next big wave is to invest a little bit more in the mortar that holds these bricks together. And I think this is what we are talking about when we talk about trust. Because a brick wall just made of many, many bricks, more and more money, more and more professionals. As my colleague Thomas likes to say, we have never had more health and care workers in Europe than we have now. Ministers will say we have never spent more on our health systems than we are spending now. But just like the mortar binds the bricks together, it's the trust that we've heard about this morning so far that we need to bind our health systems. And this is the metaphor that I would like to leave with you over the next 2 days. And in fact, it's intentional that we decided to open our first plenary based on trust immediately after the break. But before going to the break, I'd like to hand over to Christina to formally close the opening and give you some practical information. Thank you.
Thank you, Natasha. Dear ladies and gentlemen, this brings us to the end of the opening session of the conference. We are very much looking forward to the next 2 days. The program, as several of you have already mentioned, is rather full, and keeping to time is therefore a key. But of course, it is important that we hear from many of you as possible throughout the day of the conference. And we hope you will agree with us that while it might be a full program, it is also an exciting one. But before we go to our first break of the day, a number of housekeeping rules. The coffee and tea and fruit are available after this session and during all breaks in atrium and cauldron halls. You can also find coffee and tea throughout the day in the same place. Lunch for all participants will be 12:15, and it is also held in atrium and cauldron halls. For those invited to the closed ministerial lunch, this will be served in the small hall from 12:15 to 1:30, and volunteers will be around to help guide you. We will have more announcements throughout the day, but please feel free to reach out to conference staff. They are wearing white badges, or WHO staff who are wearing blue badges. And we are very much happy to answer all the questions that you might have. We will see you back in this room in 30 minutes in the first plenary session, Trust for Transformation, a Virtuous Cycle. And now we are going on a coffee break. And this is introduced by Olavi and Kairi by learning some Estonian language.
Hello! Hello, welcome to Estonia. My name is Olavi.
And I am Kairi.
And it's time to learn Estonian. So we are going to play. We have a saying, healthy body, healthy mind.
Terves kehas, terve vaim. And this basically means only that if you're healthy, then you're happy. And we all want to be healthy and happy, don't we? So for that, we ask you kindly to stand up.
Stand up.
Of course, health starts with moving, and we're going to move and learn all together.
We are going to learn more Estonian language. And these are instructions. We present 5 Estonian words on the screen.
Yes, and for each word, there's a certain movement that we will show you what you need to do.
And afterwards, words will be played in random order, and we are playing.
And you need to remember the movements and do them all together. Yes? Don't worry, we'll show you.
Yeah. So when we say tere, hello,
This means
it
hello.
means you're shaking hands with
To
your
the right,
neighbor
you can practice,
on the-
yes?
Yeah, you
to the
can
right
practice.
and to the left.
Yeah, tere.
And tere.
Tere.
This is your first Estonian word. Tere.
Very good. Tere. Shaking hands once again
Tere.
to the left and right. Next word. Aitäh.
Aitäh. This means thank you. So you can say thank you to the right and thank you to the left. Thank you. Aitäh. Aitäh.
And once again, remember words and the movement, because later on we're going to play. Third word is lahe. Cool. It's cool.
Lahe.
It's cool. 2 more to go.
Fourth word is health. Very familiar for you. Tervis. And for that, you place your hands on your shoulders and give yourself a little hug.
Hug yourself.
Tervis. Tervis.
Take care of yourself. And last but not least, head aega. Goodbye.
Head aega. This is more for later, after the
Yeah.
conference, yes?
And now we are going to play. Remember, when we tell the word, then move. Remember all those words? Should
Let's
we
repeat them,
Yeah,
yes.
let's repeat.
Tere.
Tere, tere.
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 Tere. Tere. Aitäh.
Aitäh.
Thank you.
Aitäh.
Aitäh. Cool.
Oh,
Lahe.
lahe. Cool.
Lahe.
Lahe.
Tervis.
Tervis, take care of yourself.
And finally, goodbye.
Goodbye.
Head aega. Head aega.
Are you ready to play now? Yes. So, first word is tervis.
Good job. Yes.
Well done. Second word, lahe. Cool. Third one, head aega. Next one, tere. Oh, yeah, shake hands. Shake hands.
Tere. Tere.
Aitäh. Bow.
Thank you. Thank you. Aitäh. Aitäh.
Tere. Oh, tere. Tere. Head aega. Lahe. Tervis. We can play 1 hour. Lahe.
Lahe.
Head aega.
Head aega.
Tere. Oh, tere. Tere. Aitäh. Aitäh.
Aitäh. Aitäh.
Thank you. And please visit our Estonian desk in the lobby. We would like to tell you more about Estonia and Estonians, and also we offer you dried apples and birch sap. Please
Very
come.
traditional Estonian snacks. So visit us and have a nice talk with us about Estonia.
Definitely
Welcome.
see you.
Aitäh. Head
Ja-
aega. Lahe.
Lahe.